We figured this week would be a good time to talk about women's health topics. And one of the things that we did is we asked people what they wanted to know, what they wanted us to cover about women's health. And we got some topics, and we're going to cover those. But let's kind of jump in because, one of the biggest issues when it comes to women's health is related to women actually seeking the help, the assistance, and talking about the issues that are affecting them. Most of the moms out there and a lot of the women out there in the world are the caregivers. They're the providers. They are the people that are taking care of us on a regular basis. So much so that most of the time they are ignoring their own health in an effort to try and make sure everyone else is healthy, happy, and taken care of. And as a result, what they end up doing is losing their health, which prevents them from doing the thing that they want to do most, which is to help and take care of others. Today's discussion is about that. Today's discussion is identifying the risk factors and some misconceptions about some of the risk factors, where women's fears aren't necessarily where their greatest risk is, and we're going to cover those. But what's interesting about this, and I talked about this last week during the Lunch and Learn, is here's a guy talking about women's health. What could I know about women's health? Because there's certain issues that guys just can't appreciate or understand. One, pregnancy. Ladies, no matter how much I read, no matter how much I learn, no matter how much I get educated, I will never know what it's like to be pregnant. I just won't. And guys, if you're listening, you will never understand. You can never relate. You cannot even pretend to understand that. And as a result, we need to make sure that we are as fully knowledgeable and supportive as we possibly can. There's other things that we just simply as guys can't understand. We get sick as guys and we crawl up into the fetal position and the world's coming to an end and, our world comes to a halt. Women get sick and somehow they're still able to take care of the house, take care of the kids, take care of, everything else and still make it through the sickness without crawling up into the fetal position and not being able to move. It's an amazing thing. But the motherly instinct of taking care of children, though men have it as well, it's just not the same. And we don't understand that bond or that connection. So it's one of those other things that it's hard for men to understand when we're talking about women's health, that they will actually put their own health at risk intentionally for the health of their children. One of the other things that guys, we just can't appreciate or understand is mammogram. We just don't understand. It's not something that we can get accustomed to. But what's interesting about when you start talking about diagnostic tools and things like that, 95% of men don't even have a clue of what this is. Now, right about now, a lot of women are snickering and giggling, and a lot of men are like, "What in the world is this thing?" This is the kind of the issue. And the part of the problem is, ladies, we just don't talk about our medical issues. It's not something we want to share with our partners. It's not something we want to discuss. The reality is we probably need to talk about the women's health issues more, because part of the reason why so many things are killing women isn't because they're not preventable, but because we're not talking about them, because we're not getting the information that we need, and we're not seeking the help and the care that we need in order to avoid it from happening. Obviously, the whole purpose of this tool right here is to help avoid cervical and ovarian cancers. If you don't know that and you're not talking about that and you're not talking about the issues and problems that you may suffering with, or seeking the help or advice from people that may have gone through the process, you may be at great risk because you're avoiding all the warning signs. And of course, the other one that men just simply cannot understand, and I tell you, even myself, I cannot understand this one, is this. Why? Why on God's green earth would anybody wear shoes that actually do that to their feet? It just makes no sense to me. But apparently, if the shoe is pretty, you will go through the pain of wearing them no matter what it is. And yes, that was a joke. But this is one of those issues that women suffer with in their health that men just simply can't understand. But there are some issues that we want to talk about today that are more serious, that are directly related to women's health that we need to discuss. And these are things that people actually said that they wanted to talk about. And one of them was heart health, because heart health is a great concern for women. What's interesting about it is this is the traditional cardiac management protocol in the U.S. So if you have a heart-related issue, what's going to start out is you're going to have a cardiac rehab, and then we're going to basically try to put you into a stress test, or we're going to try to do some diet and lifestyle modification once we start seeing the warning signs. We're going to try to change your lifestyle. If that doesn't work, we're going to give you a prescription of some type. That prescription can be in the form of a single pill, or it can be a multitude of pills. And if that doesn't work, then we're going to go to the implanted device model, and then eventually we're going to get to the surgery. All of this is doing nothing but putting a Band-Aid on the situation. This isn't actually resolving it. In fact, when you actually look at the numbers and you start looking at drugs that we try to combat things with, especially statins, for instance, where now I think it's 1 in 4 people are on these things. What you're dealing with is you're basically doing some harm at the same time you're doing potentially good. What I mean by that is 1 in 4 Americans are now taking a statin drug. That's a stat. But the reality is, what you're doing at the same time that you're taking the statin and trying to avoid the heart attack is you're reducing the effectiveness of vitamin K2, the nutrient critical to protect against calcification in coronary arteries. Without K2, what's happening is you're actually increasing the likelihood of calcification or blockage in arterial walls. This means that if you're taking a statin, K2 needs to be part of your supplement regimen because it's something that's critical to you. And of course, the other thing that happens is you completely deplete the body of vitamin CoQ10, and that's the nutrient necessary to protect the heart muscle. As they say, in the warning in Health Canada, while a statin may very well stop a heart attack, it very well may cause heart failure. So you need to understand and appreciate that if you're going to be on this statin and you're going to follow the traditional protocol and this is what's going to happen, you need to understand that you're going to have these vitamin deficiencies as a result, and you need to be supplementing for those. But one of the things that very few doctors talk about and more women should be aware of is this stat right here. For every 100 people prescribed a statin drug to prevent the heart attack, 1 heart attack is prevented. That's right. It has a 100 to 1 effective ratio. What that means is for every 100 people that take the statin drug, 1 heart attack is prevented. But almost 100 out of 100 get a side effect. It's astounding. In fact, those side effects can be pretty bad. The common side effects include muscle pain, headaches, nosebleeds, clouded thinking, increased blood sugar. Yes, it can actually cause type 2 diabetes, sore throats, and sexual dysfunction. The less common side effects, digestive problems, dizziness, inflammation of the pancreas, pancreatitis, itchy red rash, physical weakness, blurred vision, bruising and bleeding, yellowing of the skin. And now there have even been some studies that have linked statins to the possibility of causing or exacerbating Alzheimer-related type illnesses. That's right, so it's going beyond clouded thinking, and now we're getting into Alzheimer's-related issues as well. So if this is you and you're dealing with your heart-related issues, just know the numbers, know the facts. Understand that the drug treatment protocol isn't necessarily the way to go. So what do? What we have to do is we have to understand that our diet and lifestyle choices today are affecting what our health is going to be tomorrow. So instead of waiting until something breaks or the heart issue develops, if this is in your family history, do something about it now. Change the diet and lifestyle, improve the conditions, try to avoid this from happening in the first place. And in fact, if you need motivation, there's a financial reason to do so. Because if you get into the statin protocol, which now 1 in 4 Americans are, you are looking at $70 to $150 per month for the rest of your life to be on that statin prescription. That's right. I want that to set in. If you don't want to change for any other reason, and just know that heart disease is killing a lot of women out there, as we're about to talk about, you are looking at a financial hit to your budget where you're going to have to now come up with $70 to $150 a month just to pay for your statin drug. Now here's the issue, and here's why we wanted to talk about heart disease. Women's perception of their greatest health problems. Breast cancer by far is the thing that most women are scared about. Cancer itself, just general cancer, is second. So if you take those two together, 61% of women believe that their greatest health concern is related to cancer issues. Then 16% are other problems, 16% just don't know, 7% believe cardiovascular disease is their number one concern. Now, what's interesting about that stat is hands down, without a doubt, heart disease is the number one killer of women. It's the number one. more than all cancers, respiratory diseases, and Alzheimer's diseases combined. It is the number one. 90% of women have at least one risk factor for heart disease right now. But unfortunately, so many women are going to wait till something breaks to do something about it because they're so busy taking care of others. 64% of women who die from heart disease had no prior symptoms. So if you're one of those ladies who waits till it breaks before you do something about it, you're not getting your annual exam, you're not checking your blood pressure and your heart rates on a normal basis, you don't exercise on a regular basis. And remember, exercise does not mean lifting heavy things above your head, it just means moving. Realize that 64% of ladies, the day they found out they had heart disease was the day they died from it. And I want that to set in because it's a very important factor. 1 in 4 die within 1 year of their first heart attack. So of the 36% who survive, guess what? 1 in 4 of those die within 1 year after the first heart attack. And then, of course, a woman dies every minute of heart disease in this country. Every minute, somebody's dying of heart disease. In fact, as we've been on this presentation, we're roughly about 15 minutes into it. We've had 15 women die in this country of heart disease simply because we did not do something about it before it happened. What we did is we waited till something happened and then tried to do something about it after the fact. Not the way we want to handle things. Let's talk about thyroid. We could talk about heart disease all day long. It's a major issue for women, obviously, and it is the number one killer of women. I would actually argue that hand-to-mouth disease is the number one killer of women because our hand-to-mouth, or our hand finding our mouth way too often with the wrong thing, leads to diabetes, heart disease, thyroid issues, metabolic syndrome, and everything else. But I want to jump into thyroid because this was another topic that people wanted to cover. There was a lot of issues out there right now with thyroid-related issues and women. In fact, when you look at the stats, it's pretty scary. Women are 10 to 15 times more likely to have a thyroid problem than men. 1 in 8 women will develop a thyroid disorder during her lifetime. Most of them are going to occur later in life. 10% of Americans have thyroid antibodies. 10% of the population have the thyroid antibodies. And globally, about 200 million people have some form of thyroid disorder. This is a global issue. What's interesting, though, is the hyperthyroidism can cause miscarriage in pregnant women. So if you have a thyroid-related issue, and we're going to talk about what hypo and hyperthyroidism is in just a second, but if you do have hypothyroidism and it has been undiagnosed, you very well could be suffering from miscarriage or miscarriages as a result. Now, here's an interesting number. 1 in 4,000 newborn infants has a thyroid function deficiency. That's right, it's genetic. It's going to be one of those things that genetically is passed on from parent to child. 2% of pregnant women experience hypothyroidism. A lot of those go undiagnosed, just so you know. And 80% of those with thyroid problems have hypothyroidism. So let's jump in and understand the difference. How to recognize thyroid issues. Okay, so these are things. Now, here's the thing. I want to stop before we go into the details of this because there are some things that I'm going to start talking about, and all of a sudden, half the ladies on this webinar are going to think, "Oh my goodness, I have a thyroid issue. I need to get in the doctor tomorrow." These are to help you recognize symptoms and issues. Doesn't mean you have a thyroid issue. WebMD is an amazing tool, except for doctors absolutely hate it because most patients walk into the doctor knowing exactly what they have because they've self-diagnosed themselves. This is more of a, hey, if these things are starting to happen, especially if you have multiple of these symptoms, it is something you might want to talk to your doctor about, have a test done, because a lot of times the tests just simply are not done. So let's talk about this. Thyroid issues can be related to weight changes. That's unexplained weight changes up or down. Either way, that are uncontrollable can be related to hormonal or thyroid related issues. Cholesterol issues can be thyroid. If you have hair and skin changes, especially if you start losing body hair or you start losing your hair on your head or have thinning hair, that could be related to a hormone or thyroid related issue. That is one of the most common things. You also have the inflammation or the neck or discomfort or enlargement. That's a big issue. Bowel problems, severe long-term constipation or irritable bowel related issues. Depression and anxiety can be related to these things. Muscle and joint pain. Fatigue is a major symptom. All of these things are thyroid-related issues and how to recognize them. But hypothyroidism is one of the forms. So you have hyperthyroidism, which we'll talk about next, and hypothyroidism. Hypothyroidism can cause miscarriage, like we talked about, but it's also an underactive thyroid in which the thyroid gland does not produce sufficient thyroxine hormone. Remember, thyroid is going to produce that hormone. 1 in 8 women will develop this disorder in a lifetime. 1 in 4,000 infants have this dysfunction on birth, and then globally about 200 people. We talked about that. Here are the signs and symptoms of hypothyroidism. We talked about some of the general symptoms, but some of the other things I want people to understand. If you start having those uncontrollable puffy eyes, or the swelling of the neck area, they call it goiter, that could be related to hypothyroidism, and that's one of the common things that you get for both hyperthyroidism and hypothyroidism is that swelling of the neck area or goiter, or looks like an enlarged area around the neck. So you need to watch out for those things. Moodiness, irritability can be associated with hyperthyroidism or hormone dysfunction. Depression, persistent dry or sore throat. If you seem like you have a sore throat all the time or a dry throat that you just can't get rid of, it can be an issue. Heartburn can develop as a result of this. The thinning hair, like I said, is one of the biggest issues, or loss of body hair, either or. Severe irregularities in menstrual cycles or heavy periods that start all of a sudden. In fact, one of the things we're going to talk about is sometimes hypothyroidism and hyperthyroidism are confused with menopause in women. And we're going to show you what the differences are and what to watch out for. The statistics for hyperthyroidism, though, are less, and this is a lot less common, and part of the reason why it's not tested for on a more regular basis. But it affects about 1 million Americans. 5 to 10 times more common in women than men, most common in ages 20 to 40. So this is the one that affects younger women, not older women. And if a woman has hyperthyroidism, she has 80% higher chance of ovarian cancer. This is why it's important, if you're dealing with some of these issues or these symptoms, that you get checked out. You get the blood work to get this figured out early, because if you just ignore the symptoms and wait till something's breaking or something breaks, you could have a much bigger issue on your hands. So just be aware, hyperthyroidism is not something to play with. In fact, when you look at the symptoms, bulging eyes. So, hypothyroidism, you basically have the swelling eyes. Hyperthyroidism, you have bulging eyes. It's just one of those things that happens. Goiter, that's those little knots around the neck. Swelling of the ankles. And I know that's related to a lot of different things, but just know if it's one of those uncontrollable things, it could be related to a hormone or thyroid-related issue. Increased palpitations in the heart area, the hand tremors, breathing problems, uncontrollable hunger, mood swings, weight loss, hair loss. One of the other things that can be related to hormone-related issues and or hyperthyroidism is cold or tingling hands. So you might want to make sure that you're getting that checked out. If you have constantly cold hands, it could be a blood flow problem, but it also could be a thyroid-related issue as well. So keep an eye on that. We talked about not wanting to confuse thyroid-related issues with menopause, because what ends up happening a lot of times is doctors will listen to their patient and just relate it to menopause in women and not understand that what we're really dealing with is not menopause. What we're dealing with is a thyroid-related issue. So you need to take control of your health. You need to make sure that you are watching what the issues are. You need to understand that you are the greatest knowledge base of what's happening to your body. And don't be ashamed, don't be afraid to talk about what's happening. So let's look at these. Perimenopause or menopause-related symptoms are changes in the menstruation or cycle length or absent periods. That's the normal issue. You have breast tenderness. You have premenstrual syndrome or PMS, which consists of fatigue, irritability, food cravings. Sleep problems, hot flashes, that's obviously the common one that everyone talks about. And then, of course, weight gain is just a common part of going through the perimenopausal or menopausal system or change. Realize that's not something that you can really stop. I mean, it's one of those things. It's just part of that life change. But thyroid symptoms can actually mimic that, with the fatigue, depression, mood swings, weight gain, irregular menstrual periods, as well as sleep disturbances. they are the same. So sometimes, if you're younger than what you would think that would be common for perimenopause or menopausal related symptoms, you might want to be asking your doctor about thyroid related issues and just get checked just to make sure. Just let's have it checked just to make sure that this is not the issue that we're dealing with and the fact it is the other. Only 1 out of 4 women who have described these menopause-like symptoms are actually tested for thyroid disease. This is why we're bringing this up today. This is why we're talking about thyroid-related issues. Only 1 in 4, or 25% of women, when they're describing the issues that they're going through with their doctor, are actually tested for thyroid-related issues. Normally what they are related to are perimenopausal or menopausal-related symptoms. Most of the time these days, they're put on hormone replacement therapies. And that's just the reality of what's happening in this country. We need to take control of our health. We have to ask the questions. We have to get the test. We have to get the information. A physician can do more tests to look into other conditions, including blood tests or screening for thyroid disease. A TSH level that is higher than normal and T4 levels that are low indicate that a woman is most probably suffering from hypothyroidism. So if you don't know what those are, do a little research, find out for yourself what your T4 level is as well as your TSH to find out whether or not you may be suffering from thyroid related issues. And an antibody test may be needed to determine if you have an autoimmune condition called Hashimoto's thyroiditis. Ugh, man, couldn't get that one out. Sorry. But that's one of the other things that you may want to get checked as well if you have that antibody test and it comes back positive. Another women's health issue that we need to talk about. So we've talked about heart disease, #1 killer. We've talked about thyroid because, hey, that's going to affect a lot of women in their lifetime and a heck of a lot greater percentage than men. We got to talk about breast cancer. This is one that hits personally home with me. My mother had breast cancer. It seems like, 30 years ago now, almost, if not over. She is a cancer survivor, but we need to look at the stats and figures because, ladies, this is something that can be avoided. It is treatable. It is something that we can do something about only if you actually go get your annual exams. You have to have, I know it's unpleasant. Trust me, I've heard all the stories. I can't relate, but I have heard the stories. But breast cancer is diagnosed every 29 seconds in the world. In the U.S., every 2 minutes. But every 29 seconds in the world, somebody is diagnosed with breast cancer. So we've been talking for roughly 26 minutes. That means we have 52 women that have gotten the C-word diagnosis, the breast cancer diagnosis, since we started. It's estimated that 86.4% of the people will survive 5 or more years after being diagnosed. That's right, we're getting really good at treating breast cancer. There's estimated more than 2.8 million cancer survivors in the U.S. alone. Breast cancer is the leading cause of cancer death in women after lung cancer. That's an interesting way of saying that lung cancer is actually killing more women than breast cancer, but it is the #1 after lung cancer. And the chance of a woman dying from early stage breast cancer is estimated to be 1 in 36, or about 3%. So if we get these early screenings and we find out early, then where there is something that we can definitely do about it. Ladies, do your self-exams. Feel knots, nodes, look for anything. And if you feel something, get it checked out. Don't ignore it. Don't think, oh, that's probably nothing. Get it checked out. You would rather know than not know. And then, of course, then the incidence of breast cancer per 100,000 cases by race. As you'll see, race plays a role in this. If you're white, Caucasian, 127.9 per 100,000. African American 124.4, Asian 96.3, Hispanic 92.1, and American Indian Alaskan Native 82 out of 100,000. That's right. So genetics plays a role as well, and so does race. Know your breast cancer risk. Last week we talked about genetics. There was recently a story everyone heard about, Angelina Jolie making the decision to have both of her breasts removed because she had the BRCA genes or the BRCA mutation. And then, of course, I think it was last week, a Fox News reporter had the same thing. She decided, because she got the diagnosis that she had the BRCA1 gene, that she decided that she was going to have double breast mastectomies in order to avoid the risk of breast cancer in her lifetime. This is something that women are struggling with that we need to understand. And the way that you can understand your risk factor is to have a genetic test done to determine if you have the BRCA1 or BRCA2 mutation. Because if you do have that BRCA1 mutation, what that means is you have an 80% greater chance of develop, or is 80% is your risk of developing breast cancer in your lifetime. You have an 80% chance of developing cancer in your lifetime if you have the BRCA1 gene. So if you want to find out early, go get your genetic test. And if, of course, you are positive for BRCA1, that means you are even more, it's more imperative that you have regular exams, do self-exams, etc. So know your genes, know your risks, and get out there and get your test done so that you can determine what your history looks like. Let's talk about this one. At IdeaLife, we're not afraid to go after heady subjects, and one of the subjects that we need to talk about, because it is a women's health issue and it's not something that people ever want to talk about, is violence against women. Because it is a topic that should be discussed, and it's one that doesn't get discussed, as you're about to see. Violence against women is extremely prevalent. In fact, 1 in 3 women throughout the world will experience physical and or sexual violence by a partner or sexual violence by a non-partner. That's right. So I want that to sink in. 1 in 3 women are going to experience physical and or sexual violence by a partner or sexual violence by a non-partner in their lifetime. This is something that we have to start reporting. This is something we have to do something about. This isn't something that should be behind a closed door. If you are suffering with this, somebody who's suffering with this, reach out a hand, help, ask for help. There are people out there that are willing to help you, because when you actually start looking at the numbers, it's astounding. Women exposed to intimate partner violence. Now, this is somebody who they care about. This is somebody that they're intimate with. But if they're exposed to intimate partner violence, they're twice as likely to experience depression, twice as likely to use alcohol and create an alcohol-related disorder, 16% more likely to have a low birth weight baby, mainly because of stress and other related issues, 1.5 times more likely to acquire HIV, and 1.5 times more contract syphilis infection and chlamydia and gonorrhea. 42% of women who experience physical or sexual violence at the hands of a partner have experienced injuries as a result. Most of them go unreported. And 38% of all murders of women globally were reported as being committed by their intimate partners. This is why when a woman is murdered, the first person they look at is the person that they are intimate with. High probability that the crime was committed by the person that they cared about the most, as sad as that is. And usually it's because people ignore it, they don't want to talk about it, or the ladies don't want to discuss it with anyone or what's happening. We have to start reporting these things. We have to get it out there. We have to stop sexual violence. 90% of victims know their attacker, but only 5% or less of the cases are actually reported to police. 25% of college women report experiencing the effects of rape or attempted rape in their college careers, but very few, if any of them, are ever reported. That's 1 in 4 girls that we send to college. I mean, I've got an 18-year-old daughter who's literally on her way home today, just finished her first year at the University of Arkansas. Very proud dad, as you might guess. This is something I talked to her about. This is something I said, look, you can't hide about these things. I mean, if something happens, you need to tell somebody. You need to get it out there. I mean, you need to take care of yourself. Don't put yourself in the situation, obviously, if you can avoid it. But if it happens, then by all means, don't be afraid to stand up for your rights. So again, it's a sad state of affairs that 95% of these issues go unreported, mainly because the women want to blame themselves for the situation, or they're embarrassed, or they don't want to talk about it because of the effects it's going to have on them and their life and everything else. The reality is we got to stop this. There's only one way to do it. We have to talk about it. We can't be afraid to talk about it, and there has to be more webinars like this where we actually discuss the stats and we get the support systems in place to avoid it. 81% of women who are stalked by a current or former partner were also physically assaulted by that partner. So if you know somebody right now, if you have a friend, if you have a loved one, if you have a child, and they're being stalked by somebody that they used to date, just realize there's an 81% chance that they were physically assaulted by that person. That's a high number. I mean, that is a high likelihood that something happened. Have the discussion. Talk about it. If you're somebody who's struggling through this, realize you're not alone. This isn't, this isn't your fault. This is just the reality of the stats. So again, get out there and get the help that you need. It's out there. Other health concerns for women. We don't have the time to talk about everything. Obviously, this webinar has gone a little bit longer than the typical one, and obviously it has a lot to do with the fact that I'm personally a little fired up because of some of these issues, as you probably have heard in my voice. But some of the other things that we'll talk about at some other point in the future include things like enhancing self-esteem. Self-esteem is a big issue right now, especially for teenage girls with social media and their phones and selfies and all the rest. Promoting a healthy and realistic body image. That's a constant issue for women that a lot of men just don't understand. Countering the implied obligation to fulfill a sacrificial caretaker role. Curbing violence against women. We've talked about that. Battling against gender role socialization along with job and wage discrimination. That is a constant battle, it seems. We're dealing with the with some issues right now in a confirmation hearing that's actually going on in this country with potentially our first female CIA director. It's hard to believe it's 2018 and we've never had a female as the director of the CIA before, but hopefully we're going to have that happen real soon. And then, of course, establishing standards of emotional, physical, and spiritual well-being that are specific to women and not compared to men. All of these need to be discussed at some future time, but I just wanted to mention them because they are things that require attention and that we should pay attention to when it comes to women's health. On behalf of myself and behalf of ID Life, I wanted to wish all of the mothers out there and mothers-to-be happy Mother's Day. We had one of our very original employees in the office yesterday. She is a mother-to-be. She's about 8 months pregnant now, or will be in about 3 days. And we're looking forward to the birth of her first child. It's a little girl. But we just wanted to wish Happy Mother's Day to everyone out there. We appreciate moms. We appreciate the moms to be, and we appreciate just the ladies that are in our life and that take the time to actually watch these webinars. So, if you are a mom, if you have a mom, which we all do, or you know a mom who may not have their family near them, hey, reach out on Sunday. Tell them what you think about them. Actually, give them the love that they deserve and support them because, man, they don't do a lot to support themselves, and they're always, always, always looking after others before they look after themselves, and we need to make sure that they are appreciated and told how much they are cared about. We're all about diet, lifestyle, nutrition. We're all about healthy living. Today was more about understanding issues affecting women. Today was all about educating the ladies out there, and as far as that goes, the men out there as well, to help educate the women in their lives about the issues that they're suffering with, issues that a lot of times women just don't want to talk about, and a lot of times that men just don't understand. Guys, we need to be more supportive. We need to listen more. We need to stop trying to solve the issue. We need to listen to the issue and then be there in a supportive role. The problem with men, they always say, what is it? Men are from Mars, women are from Venus. The problem with a man is see problem, fix problem. Most of the time when ladies want to talk about their problems, they don't want the guy to fix it. They want them to listen. And unfortunately, guys want to fix it. And as a result, there's that lack of communication. Whole idea behind these webinars is to give guys the information they need to understand and so that they can be more supportive. Ladies, it's so that you will actually seek the help that you need, get out there and get it, and understand that you're not alone in some of the issues and problems that you're dealing with.